Hi, this is Dr. Vivek. I am a big fan of vitamin D. I say that it is a vitamin that works as a hormone. It is one of the best vitamins, and this is a vitamin that should be checked once or twice every year and should be in a good level. But there are some or the few cases where you should not take vitamin D. So let's look in this video what are these specific conditions. See, first thing, if you have sun in your place or you have the chance to go to the sun, so your body, your skin is gonna make the vitamin D from the sun rays. So you don't need to supplement it. It makes sense, right? So if you are going in the sun, then you don't need to supplement it. Second is, if you are taking too much calcium throughout the day, what vitamin D does, it increases the absorption of the calcium in our body. So what will happen? You are taking too much calcium. Vitamin D will increase the absorption of this all calcium, and your body will accumulate lots of calcium and can cause hypercalcemia. That's not a good thing. First of all, taking anything a lot, either it's calcium, either it's water, either it's love, it's not good for our health. So anything in excess is not good. The same with the calcium also. So if you are taking this kind of a diet, then it's better to not use the vitamin D, because it can cause hypercalcemia that can lead to the kidney stones and other symptoms of hypercalcemia. That's not good. So keep this in mind and watch what you are eating throughout your day. Third is, if you have hyperactive thyroid, because hyperactive thyroid can increase the absorption of the calcium from the food that you are eating. So if you have this, plus you are eating food that is very much rich in calcium throughout the day, then again it can cause the same problem, that's hypercalcemia, and this can cause the problems. So it's better to cut down the vitamin D for a small period of time. Either it's better to concern to your endocrinologist or to your doctor and follow his or her advice on this. Further, there are some kinds of cancer that can also increase the absorption of the calcium in our bodies. So in certain cancers, doctors recommend to decrease the dose of vitamin D or to stop taking vitamin D for a short period of time. One more cause is if you are on diuretics. What happens is, if you are on diuretic, the body will try to flush out lots of calcium to your blood to excrete out all the calcium. So what will happen is, this calcium from the blood may end in the kidneys, and this can lead to kidney stone at last. So if you are on these medicines, it's better to start taking vitamin D only after your doctor's recommendation. And the last but very important recommendation is, if you have taken vitamin D in high doses, means 5,000 or 10,000 international units per day for 2 months or 2.5 months, then it's better to decrease the dose, because this can lead to the increase in the vitamin D levels in your body, and that's also not good. So if you are on high doses, take it for 2 months. That is how I also recommend to my patient, taking it for 2 months and then cutting it out for 15-20 days. It depends upon person to person. So in this way, your body doesn't get adapted to this supplementation of vitamin D. It will get a chance to try to make it by itself or to take it from the food if you'll have the gap after every 2 months. So this will be the perfect way how you can use the vitamin D in the cycle all of the year. So these are some of my recommendations when you should not take vitamin D. Otherwise, vitamin D is very important. I also consider it in my life. So that's why I'm recommending you also that you should know all the aspects of vitamin D, when to take, when not to take. I hope this video makes any sense for you and will help you in your life. Smile more, stay happy, stay healthy.